Continuing with chapter number 4, psychological disorders. Today we will be studying about schizophrenia spectrum and other psychotic disorders. So schizophrenia is another very dramatic disorder. You all must have heard about it before as well. Schizophrenia is a descriptive term for a group of psychotic disorders in which the personal, social, and occupational functioning deteriorates. So, in this kind of a disorder, the individual's personal life, social life, and occupational functioning as well begin to dysfunction and they begin to deteriorate as a result of disturbed thought processes, because in this kind of disorders people have disturbed thought processes, they have very weird and strange perceptions, they're characterized by unusual emotional states and motor abnormalities as well. Motor abnormalities refer to body movement, body posture, coordination. It is a debilitating disorder, meaning it only gets worse. The social and psychological costs of schizophrenia are tremendous, both to patients as well as to their families and society. So, when an individual suffers from schizophrenia, only that person does not suffer alone. The entire family or the society as well gets fractured because they don't harm only themselves. Sometimes they can cause harm to their family, or it can be very hectic for the family members to look after a person who suffers from schizophrenia. So the symptoms of schizophrenia can be studied in a very systematic way. They've been divided into three types: positive symptoms, negative symptoms, and psychomotor symptoms. Positive symptoms are all those symptoms which or all those characteristics which are excesses of thought, emotion, and behavior. So the thoughts, emotions, and behaviors that are not normal and that shouldn't exist in an individual but exist in a person who has schizophrenia disorder. Negative symptoms are deficits of thought, emotion, and behavior, meaning the normal thought, emotions, and behaviors which an individual should actually have, but is missing or is deficient in a person who suffers from schizophrenia. The third type of symptoms is psychomotor symptoms. This refers to impaired body movement and coordination. Now we will look at what are positive symptoms. Positive symptoms are pathological excesses or bizarre additions to a person's behavior. So now you have all those behaviors which are functional, which are normal, behaviors that are accepted by the society. Now, a person who suffers from schizophrenia will have positive symptoms, meaning they will have behaviors, thoughts, or emotions which are very bizarre, which are very weird, and which are not socially acceptable. So, the weird additions or excesses of thoughts, behaviors, and emotions are known as positive symptoms. The positive symptoms are as follows. First one, delusions. Delusions are where you have false beliefs and false perceptions. Okay, so under delusions you have persecution, reference, grandeur, and control. Delusion of persecution is where the patient feels like someone is following them, feels like someone is going to harm them, uh, or someone is watching them, trying to plot against them and get them killed or harm them. Okay, that is delusion of persecution. So this is not really happening, but they feel like all those things are happening to them. Delusion of reference is when they feel that they are being referred to in other people's conversations, or say a patient with schizophrenia might feel that when something is being informed in the news, he might feel that the person who's reading the news is referring to him. So that is delusion of reference. Then there is delusion of grandeur, where the patient feels like he is very superior or is very grandiose as compared to other people. Delusion of control is where the patient feels like his thoughts and emotions are being controlled by some external force, by someone else outside them, and they feel like they're not in control of their own thoughts and emotions. So that's about delusions. Next we have formal thought disorders. Formal thought disorders uh, again has various contents. First one is loosening of associations, meaning if you observe a patient with schizophrenia, you'll notice that there will be derailment of thoughts or derailment of the things that they're trying to communicate. They'll talk about one aspect and suddenly they'll switch to some other very unrelated topic, okay, or unrelevant topic. And then there is neologisms, meaning they form new words, they form their own words, that is neologism. Then there is perseveration, meaning they repeat the same kinds of thoughts and same or same kinds of speech or same kinds of behaviors again and again. So repetitive thoughts, repetitive behaviors. Then there is hallucinations. Hallucination again is false perception. Here, there could be auditory hallucination where the patient hears sounds and voices that are not really present. Then there can be tactile hallucinations where they feel different kinds of sensations in their skin, although it's not really present. Somatic hallucination is where they feel like something weird is going on inside their body. So they might complain that a snake is creeping in their body, there are insects running through their skin. So that is somatic hallucination. Then there is visual hallucination. They see things around them, they see people around them that are not really present. Gustatory hallucination is where they're feeling taste of various things that they're not really eating or things that are not really there in their mouth. Olfactory hallucination is where they're able to smell things that are not really there around them. So these are hallucinations. Then there is inappropriate affect. Inappropriate affect means they feel the wrong kinds of emotions or inappropriate emotions in the wrong situation. So they might start clapping at a funeral, or they might start crying at someone's birthday. So wrong emotions in the wrong space. So as you can see, delusions, formal thought disorders, hallucinations, or inappropriate affect, these are not normal. These should not be there in a normally functioning person, but these are added, these are very weird, and they're bizarre additions to a person's behavior, and hence you put them under positive symptoms. Next we have negative symptoms. Negative symptoms are pathological deficits and include poverty of speech, blunted and flat affect, loss of volition, and social withdrawal. Meaning these things, these four uh, things should actually be there in a person, but they're deficient in a person who suffers from schizophrenia. First one is alogia, meaning poverty of speech. So there is very little or no speech at all present in a person who suffers from schizophrenia. They will not communicate. Next is blunted affect, meaning they feel the wrong kinds of or express the wrong kinds of emotions in the wrong spaces. So somewhat like inappropriate affect. Um, so they are at a funeral and then they start clapping their hands and they express happiness, they laugh very loudly. That is blunted effect. So they're very blunt. They're not sensitive towards the emotions of other people or their own emotions. Next is flat affect. Flat, see, affect here refers to emotions, okay? Look at the spelling of affect. Affect in psychology could also mean emotions or emotional factor. Flat affect is where they don't feel any emotion. It's like emotional numbing. So they're neither feeling happy nor are they feeling sad or depressed or any emotion for that matter. Okay, this should have been evolution. Evolution means where they're not able to start a particular action or a task, and even if they start it, they're not able to complete that task. So starting and completion of a task is absent in a person suffering from schizophrenia. So these are negative symptoms. Next we have psychomotor symptoms. So people with schizophrenia move less spontaneously and make odd grimaces and gestures. These symptoms may take extreme forms known as catatonia. They are so people with schizophrenia are very weird, and they're very absurd with their movements and body postures, and all those postures and all these symptoms together are known as catatonia. And catatonia can be of three types in a person with schizophrenia: catatonic stupor, then there is catatonic rigidity, and catatonic posturing. Catatonic stupor is where the patient becomes very, you know, very statue-like. That's where this word stupor comes from, and the individual refuses to make any movement in the same position. They stay for a long time, so they're just sitting and they're staring at the same place, and there is very little movement in the person. Catatonic rigidity is they can sit in very upright and straight positions and for very long hours. So they're actually undergoing some sort of pain for sitting so upright and straight, but it does not register in their mind, and they don't change their posture for a long time. That is catatonic rigidity. They sit in uncomfortable positions for a very long time. Catatonic posturing is where they sit in very bizarre and weird positions. So, for example, putting their legs on the table, or one leg on the floor and the other leg on the table, putting both their legs up on the wall and then sitting. So, very weird and bizarre, absurd kind of positions. Okay, sometimes awkward positions also. I'm sure you'll understand when I say awkward positions. So, unacceptable awkward positions, and they remain in those positions for very long time. So that's about psychomotor symptoms. So main thing you need to remember is in schizophrenia there are three types of symptoms: positive symptoms, negative symptoms, and psychomotor symptoms. And under the three broad types there are sub symptoms as well. So when you get a question on schizophrenia, make sure you make a flow chart. Even if you're asked only about positive symptoms, you can make a chart for positive symptoms. So that's about schizophrenia disorder. Thank you.